Okay, hi everyone and welcome to this evening's webinar. It's great to see a number of you tuned in live watching this, and so thank you for joining us. And for those of you watching a little bit later on the recording, thank you also for listening. My name is Phil, and we have with us today Dr. Michael Jackson, who is the Director of the Clinical Science and Doctor of Medicine program at Flinders University. So Dr. Jackson's going to be going through some information about this program as well as medicine a little bit more broadly at Flinders, and we're also more than happy to take any questions that you have throughout the evening as well. So I guess as a bit of housekeeping, there is a chat function, and we've had one person who's found good use for that so far. You're very welcome to type in any questions you have into that chat bar, and then we will address your questions as they come. I'll also come in at the end to talk to you a little bit more about what's coming up in terms of Year 12 results and some SATAC application deadlines as well. So I'll hand over to Dr. Jackson, and we'll see you a little bit later on.
Okay, well, good afternoon everybody. Thank you very much for tuning in. So hopefully we'll be able to get some questions answered along the way, perhaps as we go, and I might actually stop at certain points and just ask if anyone has anything they'd like to be clarified. And certainly that's the point of this, is for your information. So absolutely feel free, if you have questions, to absolutely send them through, and we'll deal with them as we go through. Okay, so who am I? Well, I'm an academic immunologist. That is, I work in a research capacity and a teaching capacity to do with things associated with people's blood, mostly things like antibodies. So my research interest is actually on autoimmunity, so typically associated with research around type 1 diabetes, for example. But also, as part of my job, is to be the director of the undergraduate program into medicine at Flinders. So I've been at the university for a number of years, and hopefully you'll be able to answer any of your questions as we come along. So today I'll really cover the two main courses associated with medicine at the university. That is the graduate entry Doctor of Medicine and the undergraduate double degree, the Bachelor of Clinical Sciences Doctor of Medicine BCS-MD program. Okay, so as it says there, this is a full-time program in both cases, and we ask that, of course, people apply for the year that they're expecting to start the degrees, because we don't actually defer acceptances for those degrees. Okay, so what are we talking about? So there are two ways really into medicine at Flinders. You may know that medicine at Flinders is a graduate entry program, which is actually an MD or Doctor of Medicine program, which is really aimed at an advanced master's level. So for entry into that course, you can come in two different ways. So as a graduate, for example, if you have completed or are completing a degree, you can apply for entry as a graduate to the 4-year Doctor of Medicine program. Now, Flinders has had medical studies running for since the 1970s, mid-70s in fact, but moved to that graduate program in about the mid-1990s. So we've had lots of experience as a graduate medical course over the last 20 or so years. The other thing that we've started from 2010 is our double degree undergraduate direct entry pathway. So instead of people going and getting a degree and entering as a graduate into the Doctor of Medicine, they come directly into the double degree program, the Bachelor of Clinical Science and MD double degree program. Now that program is an accelerated program. As you can see on the screen, the Bachelor of Clinical Sciences component is a 2-year program. So compared to a graduate entry, students are typically saving at least 1 year. Because most people with coming in as graduates will have done at least a 3-year undergraduate degree. Now that undergraduate pathway is really for high achieving students straight from high school. So we don't actually allow people in who have already studied at university or have a record of tertiary education. So it really is aimed at high school leavers. But certainly if you have a degree or don't get in, for example, into an undergraduate program either at Flinders or at Adelaide University, for example, the graduate program is the one for the majority of students, in fact. And that's true. We take 25 undergraduate domestic students every year into the undergraduate double degree program, but the majority of students entering the first year of the Doctor of Medicine MD are in fact graduates. So that will be the path for the majority of people. And you'll see Bachelor of Clinical Sciences 2 years has a little bit of an asterisk next to it. That means that once you're into that double degree pathway, there's no more selection for entry to the Doctor of Medicine. All we're asking is for you to maintain adequate sort of academic standards, and that is achieving a GPA of 5 out of 7, which is a credit average. So we don't have any more selection process, so you are guaranteed a place in the Doctor of Medicine when you do come in to the undergraduate double degree. However, you do need to maintain those academic standards. Okay, maybe this is a good time to ask for any questions. Hopefully I've been clear and it's relatively straightforward. Okay, that looks good. Excellent. So this is really a slide showing the basic structure of the first 2 years of the Bachelor of Clinical Sciences degree. Now, as you can see here, there's year 1 and 2, obviously a 2-year program. Now, in the middle of column are topics in black, and they are shared between 2 major streams that we have. So you could either do a medical science or health science stream. Now, they do share most of the topics. You can see here molecular basis of life, chemical studies, legal and ethical aspects of healthcare. So these are the sort of topics in first year, moving into second year, biochemistry, molecular biology, human physiology. We think that this gives students an excellent grounding for the Doctor of Medicine degree that they'll undertake for the 4-year MD. Now, the reason that we have 2 streams is because some students are a little more orientated perhaps towards medical science or research, and those students will do some topics which are dedicated to the medical science stream, things like skills for medical scientists, for example. On the health science side of it, really it's for students who are more interested perhaps in the interface between medicine and the public. So you see topics like health practitioner, this and 1 and 2, for example. These are really topics about how the health system and health professionals interact with the public. Who interacts well, which groups in society, for example, are disadvantaged and perhaps don't access medicine quite as well, or don't have access to it as readily as other groups in society. So it's some of the ethical and sort of equity issues in society and medicine. So both streams actually also allow electives. So as you can see, there are 3 elective options, perhaps in the medical science stream, and then 2 in the health science stream. And that's for students to tailor their studies to their own interests somewhat. Now, it's been true in my experience that students tend to pick medically orientated topics because they're going into medicine, they know that's what they're going to do, and they tend to set themselves up with studies that they know will help them in the 4-year MD. But this year, for example, I've just approved a student doing a language, for example, as one of their electives. And we certainly encourage that. We don't want everyone coming through into the MD looking exactly the same in terms of their study. So there are options there. If you have a burning passion to study Greek history or something, then absolutely we will accommodate that. Okay, someone's just asking, does everyone have sound? Hopefully everyone does, but maybe someone doesn't.
Yes, I might just tune in here. If anyone does, if other people who are tuning in, perhaps if you're happy to give us a bit of a message there, yep, thank you. So if you can't hear us, you probably won't be able to hear this, but if you can hear, perhaps just let us know, and I might just send in a message to those who can't hear. So you might just hear a bit of typing as Michael continues to talk now.
Yep, so I'll just mention a few things, perhaps more about the first 2 years. You can see in the second year there's a topic called Communication for Improved Patient Care. This topic is undertaken by all students in both streams, and it's really the first preparatory experience of students in terms of their communication skills associated with patient care. So this is an opportunity really to interact. We do have, for example, a placement section within that topic where students will get the opportunity to go to a health setting and actually communicate with patients. That topic's really setting you up for the first and second year of the Doctor of Medicine clinical skills component. Now that's a very, very important part of being a doctor, the ability to communicate with your patient and have the patient both trust you and be honest and open to you, and you also respect the patient, for example, and listen to them properly. Those sort of trust issues and those skills are very, very important for doctors to develop. So we do have that initial exposure to these communication aspects, for example, in the second year of the clinical sciences degree. So you can be assured that those first 2 years absolutely prepare you very, very well for the Doctor of Medicine degree that you'll undertake if you come in as an undergraduate double degree student, for example. So moving perhaps into the MD now, this is a slide showing the basic outline of the Doctor of Medicine over the 4 years. Now, as I said, most people will come into this degree as a graduate. They would have undertaken a bachelor's degree prior to entry. Now, most people, of course, will probably come in with a health or medical science type degree. We do have students coming in with physiotherapy, for example, or paramedic studies, nursing studies. So there is quite a wide range of students coming in to this program. But we do have students coming in also with degrees that are not science or medically orientated. For example, you may come in with an arts or law degree. Now, the MD is actually designed so that we can accommodate those students who don't have a strong science or medical science type background. So you can be assured if you're coming in as a graduate, everybody basically can achieve in this course. We won't be offering places to people who can't pass the course, for example. That's based on both your GAMSAT results, for example, and an interview as well. So we know that if you do get offered a place, you're more than capable of passing the course. Now you'll see here, year 1 and 2, you can see things like knowledge of health and illness, doctor and patient, progressing through into clinical performance. And what this really means is that first 2 years of the degree are a little more orientated towards the academic aspects of medicine, gaining the knowledge about normal health, normal human body functioning, and then pathology associated with disease, for example, in knowledge of health and illness. These are all the disciplines of medicine. Cardiology, immunology, for example, microbiology, neurology, all of those types of ologies really are in the knowledge of health and illness. Now, doctor and patient is, again, those clinical skills. So in other words, the interaction between the doctor and the patient in terms of assessment of illness, taking a history, for example, doing things like drawing blood or giving injections. These are skills that you develop in the clinical skills setting of the unit down at Flinders Medical Centre in a safe environment with skilled tutors, for example, giving you the skills you need before you move into practice and experience with patients. But you do get very, very early experience to patients within the course. Within a week of starting, you'll be on the wards at least, talking to patients, perhaps taking histories. So this is very much a patient and clinically orientated course, and it develops, as you develop your knowledge and your skills, you then gain more and more exposure and experience on the wards, for example, as you move into that clinical performance, 3rd and 4th year. There are other things like the advanced studies which cover the 4 years. This is the research component of the degree. So we are an advanced masters. We expect students to be able to generate, consume and understand research. So the advanced studies is a topic that you'll undertake. You have a choice amongst a wide range of topics that, for example, you can be involved in terms of research. Some students actually design their own projects, but a lot of students will take on, for example, topics that are offered by active researchers at the hospital and in the university. Health professions in society is the legal and ethical aspects of being a medical practitioner. Again, extending on ideas about equity in health, which sectors of society are perhaps poorly serviced by the medical health system, and those which are sort of heavy users of the system as well. Also things like cultural safety and other aspects are dealt with in that topic, which is also spread throughout the 4 year of the program. Years 3 and 4 are largely clinically based, so students will spend a lot of time in the hospital on the wards, for example, doing rotations in various aspects of medicine. So for example, in 3rd year you'll spend at least 6 weeks perhaps in one of the major disciplines, and then you rotate around. You may spend 6 weeks, for example, in the neonatal unit, for example, and then 6 weeks perhaps in the cardiovascular section or general medicine aspect of the hospital. So hopefully that gives you some idea about the basic outline of the degree. Again, if anyone has any questions they'd like to sort of type in now, they can do that, or you can leave it a little till the end of the presentation. Okay, so this is the entry requirements, some aspects to it. So Bachelor of Clinical Science, Doctor of Medicine, as I said, no higher education academic record. So in other words, we're targeting school leavers here. We don't have any particular topics which must have been undertaken at year 12 or 11, for example, because we believe the 2 years of preparation are more than sufficient to get you to a level for the MD. Our offers are based on your ATAR and UMAT score, and of course we know that this is a very competitive double degree course. We don't interview our domestic students. We do have interviews for international students though, but for domestic students we are really assessing your communication skills in the second year of the course in that communications topic. And of course, to continue in that 2-year degree into medicine, as I mentioned, you must pass the topics in the course and maintain a GPA of 5 at least out of 7. So those are the basic sort of requirements for entry. There we go, just moving on a little bit. Just a little bit of a few highlights which are put down here about the course. This is moving into the Doctor of Medicine component, the 4-year degree. We have a team-based learning approach. We do use larger groups or smaller group approaches within the learning. We have both lecture style, we have lectorial or tutorial style learning, we have practicals, we have tutorial sessions. There's lots of different styles that students will learn in this course. There's an early focus on clinical skill development. You can see in the picture here students are actually learning resuscitation. Okay, it's all done initially in a very safe, controlled environment with skilled tutors overseeing what goes on and largely using quite advanced mannequins really for these sort of skill development. So you can be assured that you won't be moving into patient contact in certain areas, for example resuscitation, until you're very confident, for example, that you have your skills up to scratch. And you can do that in the clinical skills unit, feeling safe, feeling secure, and building the skills and the confidence as you go along. As I mentioned, we have that research component. A lot of people are very interested in research. We know that as medical practitioners, many people will be involved in research. It's an important part of people's careers if they want to advance and get into specialist training. Then a research component and publications, for example, are very important for you to get the advantage perhaps in those sort of positions. Third and fourth year, largely fourth year of the MD, there are electives perhaps where you don't even need to do studies back here at Flinders. You may actually take an elective period overseas and spend perhaps 6 weeks, for example, in a setting, in a health setting, getting training in a site that's off-site for Flinders, for example. There's a question coming through about the UMAT. I don't know whether we separate the sections up. I think we just use the raw score. I'm not sure on that, but I can get perhaps someone to comment on whether or not the UMAT is weighted in terms of section 1 or 2.
Yeah, I just might come in here just briefly. Certainly that is, in terms of the UMAT, there is sections 1 and 2. You probably will have read that in brochures or online. That is the case that sections 1 and 2 are looked at a little bit more highly than some of the other areas. So, like Dr. Jackson was saying, that it is a weighted UMAT score that we do look at there alongside the ATAR.
Okay, thanks for that question. These are some of the good things to come through, so hopefully you can keep on filtering them through. So does anyone have any questions perhaps about the course? I know that's probably quite early because you're sort of a little way off starting, but those are some of the highlights perhaps of the course. So you can be assured that you do get excellent academic, clinical and research exposure in the course. That's part of the benefit really of having a medical school situated in the Flinders Medical Centre, which is where the course is largely delivered. because students do get an interaction between the clinical specialists, the academic staff, and the research component, which is the best training setting for a degree such as medicine. Okay, so for the MD requirements, of course, you'll be coming in with a degree, and in addition to your degree, you also need a GAMSAT score. In other words, you will have had to sit the GAMSAT and achieve at least a 50 across each of the 3 sections. Now, those are absolutely minimums, and we know that from historically, of course, students, because this is a very competitive course, higher numbers than those minimums will be more likely to be successful, for example. Again, we don't have prerequisite subjects and we don't have prerequisite degrees. So in other words, we don't ask students to all have medical or health science degrees. You can come in with any bachelor's degree as long as it's an accredited degree in Australia. We do weight the GPA or grade point average. In other words, the studies that you've undertaken in the last few years of your studies will be weighted more heavily perhaps than the first year of your degree. And offers on interview are actually based on the GAMSAT ranking. We do have sub-quotas. That's very complex. It does change, but there's a little bit of information coming up on some of those sub-quotas. So after interviews, if you've passed the interview and have an interview score, that will be added to your GAMSAT and weighted GPA to come up with a place offer list, which will go out to students. Okay, yes, the admissions guideline is absolutely the one that you should go and look online, because almost every year there's a change to one or other of the admissions processes. So to keep up to date, go online and download the latest version of that admissions guide. Just a few things perhaps that I can say about some of those sub-quotas. Certainly we do aim for at least 28% to 30% of students coming in with a rural background. So Flinders is actually committed to helping to train the rural health workforce, and that's part of our basically terms of reference really as a medical school. We have an equity understanding about that, and we do have rural sites around the country, around the state, to achieve those rural placings. For example, up to 24 students can actually do the 3rd and 4th year of the degree in those rural health settings. That's the PRCC scheme. We also have sub-quotas for Flinders qualified graduates. So in other words, up to 75% or at least 75% of students coming into the MD will hold a Flinders degree. Okay, it doesn't have to be an undergraduate degree, but it has to be a Flinders qualification at least. We also have 25 places for holders of the medical, health, science, paramedic or science biotechnology degrees at Flinders. We also have places, of course, for humanitarian visa holders and Indigenous students as well. So those are some of the sub-quotas. As I said, it's quite complex, but for students really looking to maximise their chances of getting into the MD, of course, a Flinders degree will, just looking at those sub-quotas, give you a huge advantage for getting a place in the MD here at Flinders. We do have approximately 86 graduate places. This is made up, in total there's another 25, of course, domestic students coming in through the undergraduate pathway. So there were about 110 here at Flinders campus, for example. We also have international students, so we have international intake into both the MD and the undergraduate Bachelor of Clinical Science. Okay, right, so we've got a question or two. Would we need to do an interview to offer a place in the MD if taking the undergraduate? So if you're a domestic student from high school, applying for a place in the Bachelor of Clinical Science, MD double degree, there's no interview. And what that means is basically your communication skills will be assessed within the course. So we don't interview the undergraduate student coming in. We do interview all graduate students domestically though. Okay. So this is where I think Philip comes back in.
No worries. Thank you, Dr. Jackson. That was a lot of really good information. Any more questions, feel free to type them in, because I'm going to be going through some, I guess some of the dates that are coming up and deadlines, so please feel free to pop through any more questions for either myself or Dr. Jackson. In terms of upcoming dates now, if you are applying for the Bachelor of Clinical Science, Doctor of Medicine, you will already have your SATAC application in. Keep in mind that the change of preference deadline is coming up Wednesday the 3rd of January. So what that date means is any changes you want to make to the order of your preferences in your SATAC application, you need to do before midnight on that date. So that might mean if you're considering perhaps putting in one of the undergraduate programs that would qualify you for the sub-quota, medical science, health science, those types of programs, you can make changes, put those in, change the order up until that date. And then you won't be able to access your SATAC application from the 3rd of January to the 16th of January. And the 16th of January is the main offer round. So when it comes to the main offer round, if you're made an offer, that's great. If you're not made an offer to your first preference, or you have any questions about that, then I'd certainly encourage you to get in touch with us because we can talk to you about what your options are from there. So we're certainly on board and ready to take your questions when it comes to the main offer round. And there are further offer rounds, and sometimes there can be later offers to a course if not everyone takes up their place that they've been offered in the first round. So my best advice here is to give us a call if you're unsure once the offers are out. A couple of other things, I've talked a little bit about this, but for those of you who are in Year 12 and are tuned in and you've got your ATAR coming out next Tuesday, do get in touch with us. Once you do have your ATAR, again, we can go through your SATAC preferences and give any advice before that change of preference deadline, any pathway options that we might recommend that you put into your SATAC application. Now, in terms of bonus points, we can advise you on what your adjusted ATAR is with bonus points. Do keep in mind, though, that subject bonus points are not taken into consideration for the Clinical Science Doctor of Medicine program, but they will be taken into consideration for all other Flinders preferences that you might have in your SATAC application. But again, contact us, we're more than happy to help. And also put in here as well, Dr. Jackson spoke a bit just now about some of those pathways into the Doctor of Medicine, the graduate entry, looking at those sub-quota places. We do have another webinar next Friday at 11:30 a.m. where we're going to focus specifically on pathways into medicine. So I would encourage you, if you are interested in learning more about sub-quota places and different pathways that are available, to go back to the webinar sign-up page where you would have signed up to this webinar and put your name down for that one. We'll send you a link like we did this morning for that one as well. So a bit more information there for you that specifically on the pathways. So we'd be happy to chat with you again next Friday.